Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is all four wisdom teeth, starting with the upper right wisdom tooth. As you can very clearly see right here. Let me just break this up. Thank you. So as you can very clearly see right here, so this wisdom tooth has relatively short roots, and just a few of them are non-fused, but the remaining tooth portion is very well fused and good bone support overall and relatively away from the sinus. So that's the lower right eight, the upper right eight. Now moving to the lower right eight, which is exactly here. This is a horizontal impaction, and as you can clearly see, it has relatively very dense bone surrounding it in the crown structure. And as we move towards the root structure, you can see that the mesial root at the mid-root level, close to the apical one-third, starts to come in contact with the inferior alveolar nerve. And as we move further back towards the apical part, it still continues to stay in contact. So the wisdom tooth in the lower right-hand quadrant and its roots are very intimately in contact, from mid-root level all the way down to the apex. They are very intimately in contact with the inferior alveolar nerve. Now moving to the upper left eight, which is right here. Here you can see we've got slightly longer roots in the upper left eight, and the roots are very close to the sinus right here. But good overall bone support, and the tuberosity appears to be very thick. We've got three very divergent roots in the upper left eight. Now moving to the lower left eight, as you can clearly see here, again this is also a horizontal impaction. This is the crown portion, the chamber area, and now we can see the roots differentiate. The mid-root level is relatively far away from the inferior alveolar nerve, and as we come very close to the apical one-third, so only here we see that the apical portion of the tooth is closely associated with the inferior alveolar nerve, but not significantly enough to cause any damage during extraction. But it should be kept in mind that the roots definitely are close to the inferior alveolar nerve. This is the axial view, or the top to bottom view. Here you can see the lower right wisdom tooth very closely associated. The lower left wisdom tooth is not as closely associated. Moving to the upper area to give you an idea of the root divergence, the upper right wisdom tooth has fused roots for the most part, whereas the upper left wisdom tooth has more divergent roots. Thank you very much.